Then your favorite, nasopharynx, as a part of respiratory system. Then air will pass through oropharynx, and then it will come through laryngeal inlet into larynx. This is our topics for today. So external nose, nasal cavity, and larynx. The pharynx we have already studied, so we're not stopping at it. External nose is a very simple structure. It's got tip, dorsum, root, the place where it is attached to our face, and wings, which are ala. The name is ala. The nose is generally made out of cartilage, external nose I mean, covered with skin, and maybe small amount of fat tissues can be presented. Then there is a very short part of the nose which is made out of bones, which are nasal bones. Nose is made out of nasal bones. This is simple. What are the cartilages of the nose? Let's see the picture. It is very simple actually. Please, if during the shot on respiratory system you will not find the external nose, you will be banned with a negative grade for that shot. If you can't solve this childish task, what are you doing in medical university? These are the cartilages of the nose. I'll give you the opportunity to take photo. These are the cartilages. So there is lateral cartilage. There are lateral cartilages, and then there are ala cartilages. They are divided into greater and lesser ala cartilages. It is really simple, very simple. I'll give you the opportunity to take photos. Now, nasal cavity. Nasal cavity is more complicated than the external nose, of course. First of all, as a part of your own home task, you need to find in the book, it is always written, what are the bone walls of the nasal cavity. If you have studied skull during the first term, you should have studied the bones of the nasal cavity. But maybe you have missed this topic, maybe you were not studying well during this topic, not listening to your teacher maybe, and you forgot. So you need to take these like picture, these colored pictures where every bone is colored, and find the bones that are forming the upper wall of nasal cavity, the lower wall of nasal cavity, lateral walls of nasal cavity, and septum. About septum I will tell. And the other walls you need to find by yourself. Like this. These pictures describing everything. Also find the book, open the book, everything is written in here. We are seeing the sagittal section, so we can see here the lateral wall of nasal cavity. Here will be present the lower wall, here will be the upper wall of nasal cavity. On the lateral wall of nasal cavity, we can see concha. There are 3 conchas as a common. Sometimes there can be more. 2 of them are parts of ethmoid bone. 1 of them is separated bone, which fuses with the other bones of nasal cavity. So 3 conchas are forming 3 metases in nasal cavity. Metas is the word for the pathway. So generally, this is how the scheme of nasal cavity will look like. I'll give you again the pictures. You will be able to take photos. These are upper wall, lower wall, lateral wall. So these you need to write down the names of the bone, find the bones by yourself. Next time I'll ask you. This is septum. Septum nasi is formed partly from bones, partly from cartilages. These are, this only thing I'll tell. This is single bone vomer, single perpendicular plate of ethmoid bone, and Then there is cartilage part, which is called the same with cartilago septinalis. So it means cartilage that forming septum of nasal cavity. This is easy. 2 bones, 1 cartilage, forming the border in between 2 halves of the nasal cavity. Yes, it is called septum. These are conchas coming from the lateral wall. There is superior concha, medial concha, and inferior concha. And they form in these pathways. So, in between superior concha and medial concha, there is superior nasal meatus. In between middle concha and inferior, there is middle nasal meatus. And after the inferior concha, there is inferior nasal meatus. So, it's between inferior concha and the floor of nasal cavity. By the way, floor of nasal cavity we have already studied in the topic of digestive system, because it's the same as the upper wall for oral cavity, lower wall for nasal cavity. This you should already know. Why we need these meatuses? We need these meatuses because there are some hollow spaces in bones forming skull that are situated nearby nasal cavity. And they got connections with the nasal cavity. I need to find this scary picture. This one, representing these hollow spaces in bones of skull, especially in bones of the facial skull, like in frontal maxilla, which is upper jaw, ethmoid cells. They all got some sphenoid bone. They all got some hollow spaces inside. Why for? First of all, when we are breathing air, we can just breathe it downward to lungs. Why? What we need to do with this air? What do you think we can do with it? Filter it, of course. We need to make it clear. Clear from dust, from any viral particles, for example. Also, for example, from the morning, it was rather cold in the street. It will be rather painful to breathe in this cold air. Or in summer it will be hot. Well, for us it will be hot. Maybe for you it will be normal temperature. We need to cool it. If it's rather dry in the street, we need to moisturize the air. If it's or on the opposite, very wet in the street, we need to dry the air. So this chemical treatment of the air we breathe in is performing in nasal cavity. And also, because it's a very small space, we need to increase it, and the air comes into these sinuses, which are situated just nearby the nasal cavity. They got connections with the nasal cavity. The air goes into these sinuses, comes back cleared, moisturized, drying, warm, cool, whatever it was needed. Comes back and goes down to the inferior pathways, to the larynx, to the trachea, and then to the lungs. That's why when we are talking about respiratory diseases, they are always starting with the nose, because it's the first frontier for anything viral, bacterial that comes into our respiratory system. And if this barrier wasn't enough, then we got this respiratory disease with our lungs, for example. That's why we need to study these sinuses and the connections with the nasal cavity. What are they? For this I got another picture. I'll give you opportunity to take photos. What we can see on the sagittal section and what I have shown you on the sagittal section of real head, these without conversations. And I'll show it to you again. There is frontal sinus on the sagittal section. There is sinus of sphenoid bone. We can see here the sinus of maxilla because it is in the upper jaw inside. But it will have the connection here. Also, we need always to remember about the ethmoid bone and ethmoid cells. Here are the ethmoid cells. And don't forget about the orbita. Orbita, of course, is not a sinus, it's not a hollow space, it's filled with eyeball. Still it got connection with the nose, and I will prove it to you. Now let's see the picture. So again, we already know the scheme of nasal cavity. The upper wall, the lower wall, lateral, septum. What are the cavities? Now, there is sinus frontalis, sinus sphenoidalis, here it is, ethmoid cells, which we divided into three portions, anterior, middle, and posterior. They will be like in this region. In between the frontal and sphenoid sinus, they will be orbita, and sinus of the upper jaw, sinus maxillaris. It is the largest cavity in our bones of skull. Largest cavity, really very large one. The connections. Let's see. Sinus sphenoidalis and posterior group of cells of ethmoid bone, mind this, sinus sphenoidalis and posterior group of cells of ethmoid bone, they got connection with superior nasal meatus. Then, sinus frontalis, two missing groups of the ethmoid cells which are medial and anterior. Also, sinus maxillaris, all together they are opening into the middle nasal meatus. So again, sinus frontalis, anterior and middle cells of ethmoid bone, and sinus of the upper jaw, they all open into the middle nasal meatus. Here. And the only thing that opens into the inferior nasal meatus is orbita. The connection between orbita and inferior nasal meatus is performed through nasolacrimal canal, which are formed with the bones, covered with mucous coat. We can understand this connection when we are crying, no matter why. And tears are coming down into our nose. You can feel it always when you're crying, that as you begin, there is mucus forming in your nose, and this is not mucus, these are tears that are coming down from your eyes to your nasal cavity, into inferior nasal meatus. This is why this connection 4, we really need this outflow for tears, not only from on our face, but the physiological, anatomical connection. So these are the sinuses, paranasal sinuses they are called, and their connections with the nasal cavity. I hope this is clear for you now. Again, later you will have opportunity to take pictures. Now let's go. I'll give you time to process the information. Not very large amount of time, because as I'm not asking you today, we can have our informational part of the class and then be on our way. So I suggest to end up the class earlier than usual. Then we are going down from, this is septum nasal, by the way. So this was external nose, this is septum nasal cavity, nasopharynx, oropharynx. Now we are in larynx. Larynx is a rather short organ, but is very important, because in larynx situated what? Larynx is sound box. What is situated in this sound box? Vocal cords, of course, vocal cords. Without the larynx, without vocal cords, we won't be able to speak. Very short one, which is situated just below hyoid bone. So for those students who haven't studied where hyoid bone is during digestive system, another opportunity to find the hyoid bone and to find where it is attached with the larynx. So it starts from hyoid bone level like C4 and is continued until C6, C7. A very short one organ, yet very important. Larynx, as you will see, as many organs of respiratory system, even starting from the nose, which were already made out of cartilage. Larynx is also made out of cartilage. They are forming skeleton of larynx. And as you will see next class, trachea and bronchi will be also made out of cartilage. Why suddenly cartilage? There was no cartilage in digestive system. Everything was soft in digestive system. Because for digestive system, we needed to increase and decrease the not only surface, the space, lumen in the organ. And for respiratory system, we always need them to maintain their lumen. Because if they will decrease, if they will collapse, the air won't pass through, we will suffocate. That's why we need these skeleton-like structures, but we don't need the bones, so there is cartilage. Let's see what are the cartilage embedments.